Senator Roger Marshall is also a doctor, perfect person to talk to about this. And I'm glad because it makes my brain hurt trying to figure out how government and insurance companies and all this stuff works together. And I know it's all very expensive, which is probably the point. But explain to us what exactly he wants to do here and what would the result be.
Yeah, Rob, well, the Affordable Care Act came along. The insurance companies wrote that. And since then, we're spending $150 billion a year directly to the insurance company. We want to take at least a big portion of that and put it in a customer's healthcare savings account or a similar product and let them make the choices. Like President Trump said, we need to stop sending money to big insurance companies whose their values have went up 1,000% since Obamacare. Let's take that $150 billion and put it into your HSA. Just like you have a debit card, we can put money in your Trump card. You can go to your doctor, you can go to your pharmacy, and you would use that for your out-of-pocket expenses.
Why is it that it's an interesting idea? Why is it that Obamacare has been such a disaster? Why is it that we're seeing prices going up and you're seeing less options for people and it just hasn't worked? Is there a way that you can describe that to us?
Yeah, well, number one, there's a lot of fraud. So a third of the people in Obamacare don't even exist. They're ghost patients. That's another story for another day. But what Obamacare did is took Americans and made them not consumers again. So they weren't in charge of shopping, so to speak. So by making them consumers again, by giving them their subsidy to their own debit card, so to speak, and by promoting transparency, we have a price tags bill that's going to force all the hospitals, surgery centers, imaging centers, labs to show your prices before. So the Obamacare did just the opposite. It was a step towards Medicare for all, if you will.
Yeah, and the way is there any? This is the tough question that Republicans keep getting: is there any viable way to fix this? Because there's been a lot of time here to come up with a better idea. I don't know. Does it just not exist because there's no way to have a successful government healthcare program?
Well, look, I do think that there's a way to fix it, and that's why I came here. I want to add one more point on Obamacare. Overregulation led to consolidation of industry. It happened with Dodd-Frank as well. All the regulations caused us to take nurses off the floor and make them into data input people. But there is a way to fix it. I was speaking with Dr. Oz today, working with Dr. Oz since New Year's Eve on a way to fix this as well. Lots of the doc caucus is involved with this. Dr. Cassidy, Rick Scott, there's others up here that have ideas, and they're more than an idea. They're concepts. Actually, Speaker Johnson and I wrote a bill when we were freshman congressmen to replace Obamacare with as well. But it all starts with let's figure out the fraud. Let's stop sending money to insurance companies. Let's send it to patients. That's the first step of it. And then let's give people more choices. Let's let them choose a health ministry plan or an association healthcare plan. Let insurance go across state lines. Set up invisible high-risk pools. So there's about a dozen things we need to do. We're on it. We're going to get this done here in the next couple of months.
Next couple of months. Okay. Senator Roger Marshall, good to see you. Thanks so much. We appreciate it. At the White House today.